Hello, my name is Henry Vero. I am a registered nurse. I am finishing my BSN at Northwest Florida State College, and I am here at Shands Lake Shore to implement a GAR sputum collection tool. The GAR form is going to be included in every nurse's admission packet. This is going to help the nurse identify if a sputum collection is necessary during the patient's admission. With the G, the nurse is going to gather the history. Things like, has the patient had a productive cough in the days leading to an admission? Is the patient a smoker? Has the patient ever had MRSA in his or her sputum? If the answer is yes to any of these, you would check it and then write out the answer to the question. Now, if more space is necessary, it could be written out here. For example, is the patient a smoker? Yes, the patient is a smoker and has been a smoker for so and so, and then has smoked so many packs a day. Following the gathering of the history, the nurse is going to have to assess the patient. If the patient is hypoxic, does the patient have adventitious breath sounds, wheezing, bronchi? Okay. Does the patient have any abnormal breathing pattern? Check for the following signs and symptoms. Have this patient have any fatigue, chills, swollen lymph nodes, runny nose, elevated temperature? Okay, there is another section here where the nurse can go ahead and add additional notes related to these questions. This form is also going to remind the nurse to review some labs and diagnostics. Okay, so are there any abnormalities in the ABGs? Maybe respiratory acidosis. Is there any chest and x-rays abnormalities like infiltrates in the lungs, pleural effusion, or maybe an elevated white blood cell count? This is where the nurse will write down the gathered information, okay? And then as the other sections, there's a notes section here where they can put extra notes. Once the nurse completes all these three sections on any given patient, okay, now they have a history to present to the doctor to possibly recommend a sputum odor from the date of admission instead of following days. Alright, so an example for the GAR sputum collection tool. Alright, say for example, the patient is admitted and they have had MRSA in the past, okay? And maybe none of these are positive and everything is negative, but then you come over here and they have a elevated white blood cell count. So the nurse can then go ahead with the gathered information, call the doctor, and recommend, based on the assessment, that a sputum collection should be maybe ordered. This is where the nurse will write the order. It's a verbal order, a telephone order, and then the time and date. Let's say the patient is admitted, and maybe it is a respiratory patient, with a sputum order. The nurse can go ahead and obviously skip the GAR sputum collection tool and can flip to the back side where it is the sputum specimen collection. This sheet just serves as a reminder and possible recommendation of further orders for the patient. The nurse has verified that the patient has a sterile specimen cup at bedside. Go ahead and put their initials there. The incentive spirometer at bedside, initials there. Position your patient on the side of the bed. If the patient is unable to sit up, okay, place the patient in a high Fowler's position. Then patient is educated to take at least 3 deep breaths, then force out a deep cough. Verify that the patient is coughing up thick secretions rather than thin secretions, which that can be saliva. Alright, so after all these steps are followed and the nurse has put their initials and still there is no cough or productive cough, we can go ahead and move on to sputum induction. The nurse can then notify the attending practitioner that the patient has an unproductive cough or has not been able to collect a sputum sample. So then the nurse can recommend to the doctor a possible hypertonic nebulizer or chest physiotherapy, and then the nurse can go ahead and order and sign for the doctor's order. If no order is given, even after sputum induction is recommended, the reason should be written here, and then following up, we can look back to see what the main reason why doctors are not ordering sputum induction is, and we can make changes accordingly.